a guide on how to taper off Suboxone. If you're watching this, chances are you've taken the critical step to overcome opioid addiction and are looking towards a bright future in recovery. In this video, we'll be discussing how to taper off Suboxone. Tapering off Suboxone involves gradually reducing your dose to discontinue medication use safely. This guide will cover why tapering is recommended over quitting cold turkey, the difference between short and long tapers, and steps on getting off Suboxone. Tapering off Suboxone is considered the safest way to discontinue medication used under the supervision of a doctor. This slow and controlled approach reduces the risk of severe withdrawal symptoms and allows your body to adjust gradually. Your Suboxone doctor will monitor your progress and adjust your dose as needed to ensure a successful taper. Suboxone detox can be complex because Suboxone is a long-acting medication that stays in your system longer than other opioids. Abruptly quitting can cause severe withdrawal symptoms that are both physical and psychological. That's why Suboxone detox programs are so essential and why tapering off Suboxone is recommended over quitting cold turkey. Gradually tapering off allows your body to adjust slowly and makes the process smoother. A study found no significant difference between short and long tapers, but each person is unique and may need a longer or shorter taper. Your doctor will help develop a plan that best suits your needs and goals. A shorter taper may take as little as a week, while a longer taper could take several weeks or even months. Now that you know the basics of tapering off Suboxone, let's examine a few steps for getting off Suboxone. Work with your Suboxone doctor to find the appropriate and effective dose. Expect to discuss the amount of Suboxone you've been taking, how long you've been on it, and any other medications or substances you are currently taking. Create a timeline for tapering off with the help of your doctor. The timeline may vary depending on the length of time you've taken Suboxone. A detox timeline should involve decreasing your dose by 10 to 20% every 4 to 7 days until you reach the end of your taper. Once the tapering begins, you'll feel uncomfortable as the dosage is reduced due to withdrawal symptoms. Talk to your doctor about the proper medications to manage withdrawal symptoms during tapering. Your doctor will monitor your progress and adjust your dose as needed. It involves regular follow-up appointments where your doctor can check your progress and adjust as needed. Tapering off Suboxone can cause a wide range of physical and psychological symptoms. While everyone's experience is different, there are some common symptoms that you may experience while tapering off Suboxone. Common physical symptoms include difficulty sleeping, changes in appetite, nausea, body aches and pains, headaches, fever and chills, and sweating. Other psychological effects can vary from person to person, but may include anxiety or depression, irritability, mood swings, cravings for the drug, difficulty concentrating, or even flashbacks. It is essential to be aware of these potential symptoms to manage them as best as possible while tapering off Suboxone. It is also a good idea to talk to your doctor and tell them if these symptoms become too much for you to handle. Working with a certified Suboxone doctor will significantly increase your chances of successfully tapering off Suboxone. They can help you create a personalized plan for tapering and provide the necessary guidance and support. If you're looking to taper off Suboxone, be sure to find a certified doctor who is experienced in Suboxone treatment. Visit SuboxoneDoctor.com to find certified Suboxone doctors near you today.